one.
Good morning. Today is the 10th of May and the World Lupus Day. And in celebration of this, we'll be talking about skin health and immunity. Thank you, Dr. Ayesha, for coming and joining us again, and Dr. Folakemi Cole-Adeife. It's a pleasure to have you both on the program.
Thank you very much, Dr. Ajay.
Thank you, ma'am, for inviting us.
Now we're talking about the skin. Can you just tell us, I think if we can just start with Dr. Ayesha, tell us what is the skin? And can you tell us about the skin and its relation to the health of the body?
Well, we'll start off by saying that the skin is the largest organ of the body. So it has a protective role, and it plays an important part in the body's immune system. It actually acts in its most important role as a physical barrier, that protects the body from any external injury, the external environment. It's that barrier that you have that protects you from outside. It also helps to regulate the immune system, and you have certain immune cells that are part of the communication with other immune cells in the body, that act together to protect ourselves and in what we call the immune system itself. Now, when you have deregulation of your immune system, then it leads to, poor defense mechanisms, poor repair functions, because the body also acts, or the skin rather acts in a repair role. So once your immunity is depressed, the skin is not able to act adequately and perform its function optimally.
Now, the skin is a very important part of our bodies because it's something that people see first. They see you, they see your skin. And in terms of beauty, particularly for us as women, it's a very important part of it. So not only does the skin play a part in terms of the health of our body, but also in terms of our mental health, because once you have physical beauty, you tend to feel better about yourself. And if you have something wrong with your skin, it tends to also affect you mentally. So the skin is a very, very important organ. And yet we don't take enough care of it. I know, Dr. Folake, you're particularly interested in the microbiome, the skin's microbiome. Can you tell us about the skin's microbiome and why you are so concerned about it in our own environment?
Okay, thank you. Well, the skin is not sterile, as a lot of people erroneously believe. Our skin is like an ecosystem of multiple microorganisms, friendly microorganisms, bacteria, some fungi, and even some viruses and some mites. And the skin has evolved to have these a symbiotic relationship with some of these microorganisms, and they help the immune system, the skin's immune system, to be properly regulated and not to be hyperactive. And so when that is distorted, it can affect the immune system of the skin. It can affect a lot of things, about the skin. And, in our environment, we tend to believe that we need to really scrub our skin clean. We need to disinfect it. And there really is a very common habit of the use of antiseptic soaps and liquids to bathe, which are erroneously believed to be beneficial to the skin. But recent research and studies have shown that those chemicals distort the normal microbiome of the skin, and this can lead to the aggravation of several inflammatory skin disorders, including atopic dermatitis, acne vulgaris, seborrheic dermatitis, and several other things. We also have a very high prevalence of something we call tinea versicolor, and this has also been linked to the practice of, tampering with the skin's natural ecosystem or microbiome. We also, in our environment, tend to be, we have what we call a gbogbo niche cream. So anytime anyone has a rash or something on the skin, the first thing they do is treat it with the triple action cream, which contains steroids. Steroids are also a category of medications that alter the microbiome of the skin because they suppress the skin's natural immunity, in its ability to protect itself. And that also has untoward effects on the skin. So we do need to educate the public a lot more that they do not need to disinfect or sterilize their skin on a daily basis. And that contrary to a lot of the advertisements that we do see on television and on radio and on billboards, antiseptic soaps and liquids are not, the best option for everyday long-term skincare.
Wow, well, that's so important. Dr. Folake, so can you tell us about nutrition and the skin? What role does nutrition play in all of this?
Oh, nutrition has a very essential or plays a very essential role in skin health. Basically, we are what we eat and drink. So we do need to be very to pay attention to what we put in our mouths because there is a saying that beauty is not only skin deep, and your skin is not just what you put on it, but it's actually what you put into your body. And our nutrition is a reflection in many cases. Our skin health is a reflection of our nutrition. There are many skin disorders that, arise from nutritional deficiencies of the skin. And one of them, for example, is pellagra, where there's a deficiency of vitamin B vitamins, and that can lead to rashes on the skin. Zinc deficiency can also lead to rashes on the skin. There are several, if a person is anemic, it will also tell on their skin that they don't have enough blood, or they're not having enough iron intake. So nutrition is very, very essential for healthy skin. And I always tell my patients that the key to having fresh looking skin is not just buying the most expensive creams and soaps and having a 10-step skincare routine. If you're not eating properly, if you're not having an adequate diet, a balanced diet on a regular basis that is rich in all the classes of food, including healthy fats, minerals, vitamins, and healthy carbohydrates, it will show on your skin, and you can't have a healthy, beautiful skin, no matter how many cosmetic procedures that you do, including water. Water is very essential. As we know, our bodies are about 75% water, and if one does not take enough water, their skin will look dehydrated and dry. So the nutrition is very essential to skin health and must be paid attention to, and is part of the treatment or the management of the skin.
Now, I think that's so important because, a lot of people think, to get my skin looking good, I just need to look for the most expensive skin cream to use. And in fact, interestingly, people always come to me and say, oh, you got such nice skin. So what cream do you use? What cream do you use? And they're always very surprised when I say, that what I do is I eat green vegetables every day. At least I do my best to make sure I have green vegetables and fruit every day. And they look at you as if you're trying to hide the name of the cream.
The secrets. Yes, that happens a lot. And I always tell them, look, if you want healthy, yes, it has to start from your diet. I mean, you can't have high carbohydrate, refined sugars, not enough water, or you smoke or take lots of alcohol and expect your skin to look great. It's just not going to work. You have to combine, the topical skincare with a proper diet.
Now, we've talked about it is very interesting because a lot of people also, going back to your discussion on the microbiome, say that Staph aureus is a problem. And when you have the skin, you take your, organisms, you have a swab of any kind and you see Staph aureus, that must be treated with antibiotics. Now, is this a controversial issue or not?
Well, it's a bit controversial because there is usually the problem is that a lot of our laboratories in Nigeria are not able to distinguish between Staphylococcus aureus and Staphylococcus epidermidis. They are very similar, and a lot of the times when we have a report of Staphylococcus aureus, it's actually Staphylococcus epidermidis, which is a normal skin commensal and is a healthy staphylococcal microbe that lives on the skin naturally and has benefits for the skin. So a lot of times, they swab and say, oh, it's Staph aureus. Staph aureus is not a normal commensal and can lead to infections and the like. But in most cases, we find that where it is called Staph aureus, it's actually Staph epidermidis, and that does not need to be treated. That is a normal skin commensal that everyone is meant to have on their skin, and it should be left alone. So when we see a microbiology report or an MCS report that says Staph aureus sensitive to this and this, we usually take it with a pinch of salt. And Staphylococcus aureus has gotten really bad rap, in the society and among laymen as being a really, really bad guy, but it's actually not as it is. So in most cases, if you have a report saying Staphylococcus aureus, we usually just ignore it, except there are some extra, we can actually prove that it is a pathogenic form of Staphylococcus aureus. We have what we call the MRSA, the methicillin-resistant Staphylococcus aureus, which is the harmful or pathogenic type of Staphylococcus aureus that requires treatment. But in most cases, you do not need to treat, a swab that only
Comes
gives
up like that.
Staphylococcus aureus, especially if, yes, there is no serious problem.
Now, Dr. Aisha, yes, you spoke earlier about the skin and the skin's immunity. And we are just to, understand a bit better what you were really talking about. Now, sometimes we find that a person, when they are about to have diabetes, for example, or they have diabetes, sometimes they start having, boils. Sometimes they start having fungal infections. And then people then say, you know what, with all these skin infections, let's look and let's check for the sugar. And that's when they find out, you know what, the diabetes has caused this problem. Now, should it be that anyone, for example, people who are listening now here today, should be looking at their skins and saying, you know what, if you start getting anything unusual, you should think about these things? Is it something that they should reflect on?
Well, definitely. As I mentioned, if your immune system is broken down, the cells on the skin, the Langerhans cells that, help in their protective mechanism, they're not able to do this effectively. So they're prone to viruses, they're prone to bacteria, they're prone to fungal infections. And then, like you mentioned, with persons who have diabetes, of course, with their dysregulated blood sugar levels, they're even more prone. So these things just lurk around, their skin. And then, with the elevated blood sugar and the fact that they're not able to mount a proper response, they become prone in particular to fungal infections and occasionally, bacterial infections. So you would have your boils, you would have fungal infections of the skin and, the nails and things like that. So it is quite, it is one of the manifestations of patients with diabetes mellitus.
Dr. Aisha, you talked about the skin and immunity, but what about autoimmunity? Today being the World Lupus Day, what is it about lupus that makes it show first in the skin?
Okay, so celebrating World Lupus Day, it's always great to talk about it. Lupus is an autoimmune condition. and it affects various organs. The skin is not spared. So apart from the fact that it affects the central nervous system, it affects the heart, it affects the lungs, it affects the kidneys, it does affect the skin. And like you mentioned earlier, the skin is the window, it's the picture that you see first. So there are other manifestations of lupus in these various organs. But the important thing is when it affects the face, it characteristically has this butterfly rash that you can see. You can also see lesions on other parts of the face, the photo-exposed, sun-exposed parts of the body. It can affect the hair. So these are things that, just shout out at you because you can see them. You can't see the other organs, but you would characteristically see these funny lesions. But, the butterfly rash, which is which is characteristic of lupus, even though it's more obvious and said to be documented more amongst Caucasians, we do find it amongst Africans, but it doesn't mean that they all have it. You would have other lesions. They're called chronic lesions. You can have acute lesions. Chronic meaning they look darker. They're not as hyperpigmented. They've been on for ages in these photo-exposed parts of the body. And then when they're acute, they could be weepy. They could be more reddened. And of course, they're very itchy and it's disfiguring. So your patient would be bothered. So we also say when you have lesions that haven't gone away 2 to 4 weeks, you've been to the GP, you've been to the pharmacist or wherever else it is that you go, please see a dermatologist because you want to be sure.
That's important. And other autoimmune conditions, many of them, or should we even say most of them, have some sort of reflection in the skin.
Yes, because of the dysregulation of the involvement of the immune system.
And so it's very important that any lesions seen in the skin are taken very, very seriously. Now, do we have any events coming up for this World Lupus Day today that people who might be interested in knowing more about it can attend?
Okay, there is an event at the LASUTH, the Lagos State University Teaching Hospital, at 12 o'clock. So they'll be talking about, I will share the details so that you can put it on your Instagram and social media handles. And so there will be a panel of speakers talking about various things that are affecting lupus patients. It's open to the public. There will also be a webinar including...
Is it free?
Yes, it's free.
Or do people have to pay?
It's free.
Okay, so people can attend.
There will also be a webinar talking about lupus, and this is targeted at medical personnel so that they are able to recognize this better. People also go to the pharmacist, they go to the chemist, they go to the GPs as well. So we also want everyone just, in a continuous mission and vision of trying to educate and increase awareness. So there will be a webinar in 2 weeks' time. And then there will be another activity that the Laba Laba Foundation will be hosting for lupus patients. So I'll give you the details for the social media.
Okay, so I will say that for all those who are interested in these events, they can come to the Doctors on Air website and visit all our other platforms in about 24 hours to start seeing, actually, for this one for 12 o'clock, just go straight to LASUTH, but for the one for the webinar and Laba Laba Foundation, about 24 hours, the information will be up on the website. Now, Dr. Folake, we want to talk about how to maintain skin health. But before we talk about the issue of maintaining skin health, there are a number of things that people do. So we want to know, is it good, is it bad? A number of people use Roaccutane. They go to the pharmacist, they buy Roaccutane, they say it keeps you looking younger, they say all sorts of things. How do you see this? In addition to that, we have a lot of people who are now going to our med spas, taking IV injections of glutathione, vitamin C. They say, well, it's vitamin C, so it's good for you. And they're taking all of these things. I mean, what are the effects on the body? Are these things really good or are they not? How can people tell?
Well, it's very worrisome that people are actually, people who are not qualified to recommend or prescribe or to administer these treatments are doing so. Roaccutane, which is isotretinoin, is a very good medication that is used in the treatment of moderate to severe acne. But it has a lot of untoward effects and can be teratogenic, meaning that it can actually cause deformities of a fetus in a pregnant woman. So we are very, very, very cautious in prescribing Roaccutane, particularly to women of childbearing age. So I wouldn't advise anyone to just go and buy Roaccutane over the counter without it being prescribed by a dermatologist. And I would like to discourage pharmacists from selling Roaccutane to patients without a prescription. There is a lot of counseling that needs to go into um, the prescription of Roaccutane, particularly to young women. They need to be able to commit to not being pregnant for at least a year while they're on that medication. And they need to have frequent pregnancy tests to, ensure that pregnancy is prevented. And they need to use, forms of contraception. So all those things are meant to be, they are meant to be counseled about those things before commencing. There are other side effects. It can cause dryness of the lips, dryness of the eyes, and people need to be aware of these things. So just going over the counter to buy Roaccutane is very, very harmful, can be very, very harmful and dangerous. And we want to discourage that from people doing that. And as regards to the med spas, yes, the latest fad is the use of IV glutathione and IV vitamin C and other IV nutrients for skin health. While some of those things have, their benefits, they do actually improve the appearance of the skin. We are a bit cautious because we're not sure about the long-term side effects of using such high doses of glutathione, which is a naturally occurring molecule in the body. Our body produces glutathione, but the quantities of glutathione that are being administered intravenously are very high. And we're not sure if in the long run there will be any untoward effects to such high doses of glutathione. High doses of vitamin C are known to possibly cause kidney stones. So people need to be careful with administering very, very high doses of vitamin C intravenously particularly without adequate hydration. So I would ask people to be very cautious and do a lot of research before you just go to a med spa, follow a fad. Oh, my friends are going to the spa to get this treatment. I'm just going to go along. And also, some people have manifested allergic or anaphylactic reaction to some of these IV medications, which, was almost life-threatening. So we need to be really careful and, do research about these things. A lot of med spas offer this service, and it's very common, very popular in Lagos today. And some aesthetic physicians offer it, but with dermatologists, we're still a bit cautious because there are not enough studies to show that it is completely safe.
Yeah, I mean, unfortunately, time is really against us, and we should actually spend a lot of time
Right.
talking about it, particularly in due to the fact that there's so much kidney failure in Nigeria, and we really don't know why. There's just so many things that people do but are irregular, and people are not really. If we just have a word from yourself and a word from Dr. Ayesha, just give a few last words to our listeners, what would they be?
So I would say that
my last words would be the use of sunscreen. I think that the culture is improving. At least I see patients, and when I say, "Oh, do you use sunscreen?" At least I'm now hearing yes. So we're getting somewhere, but we still haven't reached, maybe 1/10 or so of where we need to go, considering the population of Nigerians. We live in the tropics. The sun is harsh. So sunscreen, sunscreen, sunscreen. But particularly when you're talking about, okay, of course, our lupus patients, people with damaged skin, at least those who first of all present to us the need to use sunscreen. But it's not just for damage, it is for everyday skin. So I think that would be the most important thing I would like to say, as well as remembering that as we practice healthy lifestyle, the same thing applies to our skin. Balanced diet, lots of water, vitamins, vitamin C, healthy vegetables, and fruits. That would be what I'd like to say.
Thank you very much.
Thank you. And I would just like to add that people should not self-medicate with their skin. If you have a skin problem and it's persisting, please try to see a doctor. Don't just go to a store, a pharmacist, and buy, a triple action cream and apply to that skin problem. It may actually complicate it. So if you watch it for maybe a week and it's persisting or getting worse, then please try to see a doctor, or if you know how to get to a dermatologist, preferably try to see a dermatologist to have, a professional opinion and professional recommendations for that skin problem. Thank you.
Thank you for watching. Please like, share and subscribe for new video updates.